Doctors and nurses of Reddit. What have been your "why didn't you come in sooner" moments? Had a patient brought in by her son who took care of her. When she arrived to our unit, I performed a skin assessment. Took off her socks and found a fallen off gangrenous toe. Seems fake, and I wish this was, but it was by far the nastiest thing I've ever witnessed. Son said he had no idea when his mother's foot became that bad. No words. Story 2. A&D/ED doctor here. A farmer in his 70s reluctantly came in with his wife after falling over outside while wrangling a sheep 1 week earlier. He didn't want to be there but was forced to come by his wife who was worried about him. On questioning/examining, he was pale, short of breath, and clearly in pain all over the right side of his chest but not wanting to show it. X-ray and bloods showed he'd broken loads of ribs, punctured his lung and bled profusely into his chest, and was now very anemic. I feel like we're gonna get a lot of rural ones here. From the medical skits I've seen on YouTube, which is somehow a hole I fell into at some point in my life, rural patients tend to wait until it's not necessarily too late, but way later than they should to seek medical attention. They're very, we can do it ourselves out here, we're fine kind of vibe. Story 3. Story from my sister-in-law who's a nurse. Young man was brought into the ER. He had a sinus infection that he had let get to the point that it had eaten through the skull and into his brain. She was told that it had started several months before. He didn't want to go to the doctor for it. All it would have needed was 10 days of antibiotic pills. Instead, he wasn't brought in until he was unconscious and died within a few hours. Story 4. I had a patient come in saying he couldn't see. How long has it been going on? 5 days. The man had been blind for 5 days and didn't come in because he thought it might be a cold or something. During the exam, when I asked him to move his legs, he said, "Oh, I can't do that." What? I asked him how long he had been unable to move his legs for or walk. Wife chimes in, "About 2 years." Never saw a doctor about it. They just borrowed a friend's wheelchair and kept it rolling. Turned out he'd had multiple strokes with multiple risk factors he never addressed. Given how little insight he appeared to have into the condition, I honestly felt sorry. He also didn't have insurance, so I'm sure that played a role in him avoiding seeing anyone. Look, I'm just saying, not to be the superior Canadian or anything, but it is really dystopian that if you don't have insurance or anything like that, that you don't want to seek medical attention when something could be really wrong with you. Like, imagine reaching the point where it's like, oh, my legs don't move anymore. That's too bad. I don't have fake money given by big corporations. Dang. Story 5. Children's nurse here. My first week in pediatric ED, we had a young girl, 6 or 7, come in with a really swollen jaw/face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mom told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing around to get out of school. At some point you have to know, right? At some point earlier than this, it has to be obvious that she's not faking it, right? What a horrific parenting fail. Story 6. Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years, so the doctor asked that she come in to be evaluated before prescription could be given. She refused and called again the next day asking for a prescription again. This all went on for a week. Her calling for pain meds, the doctor asking her to come in to be seen, and she finally agreed to make an appointment. It wasn't shingles, it was a skin ulceration from advanced breast cancer. Story 7. Not a nurse/doctor, but a lab scientist. Had a guy come in at the end of the day for chest pain that's been bothering him all weekend. The ED doc ordered a troponin blood test which helped rule in/out heart attacks. If the test runs above 0.03, we consider that as a sign for a heart attack and act accordingly. This guy's very first troponin was 21.00. 21. The highest we've ever had up until then was an 8.00. The guy should have been dead ages ago, but he somehow pulled through. Don't ignore chest pains, people. This dude had plot armor. I have no idea what a troponin test or any of that is, but all I know, 21 is bigger than 0.03. A lot bigger. Story 8. I've seen a few over the years, and they generally fall into the category of, if it's not diagnosed, then I can't have it. Or, I didn't think it was that bad. As a medical student, I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years, but if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category, I've seen a few cases of Fournier's gangrene, pretty much obese male diabetics that had a pimple/sore that started in the pubic region. By the time they come to the hospital, it's a raging infection where the treatment is basically to cut away everything in the pubic/groin region down to the muscle layer. That little sore didn't seem like much at first. Story 9. I was working as a surgical junior when my team was called down to A&E to see a patient who had come in with a complication from a recent hernia operation. When we came down, we saw that the patient was holding a plastic bag over their abdomen. When this was removed, we found that their wound had opened and their intestine was visible to the air. It transpired that this was not something that had happened overnight. It had taken several days. The patient had started using plastic bags and newspaper to dress the wound when they ran out of dressings. I call that a little more than a complication. My intestines out there? No. Story 10. Not a doctor or nurse, but worked as a doctor's office assistant. A regular patient who was very sweet, but unfortunately had an ongoing battle with alcoholism was brought in by his roommate, and I knew instantly that he was dead soon. I'd seen some jaundiced humans in my lifetime, but this man was yellow I never knew was possible. His roommate said through tears, "I've been telling him to come in for weeks." And the patient kept telling roommate to relax, "I'm fine," majorly in denial. I helped him into the exam room, and when the doctor entered the room, he immediately asked me to call an ambulance. A few weeks earlier wouldn't have helped, but perhaps the end could have been made a bit easier for him. He died 7 days later in the hospital. Hit me very hard, because I'd known the guy for years. Sometimes he would be sober when he called, and sometimes he would be slurring and completely incoherent. But he was always kind. This is probably one of the most brutal results of addiction. To have the people around you be able to see that you are slowly drinking yourself to death and you can't do anything about it, or don't want to do anything about it, or whatever. Just an awful situation. I'm so sorry for OP for having to witness that and just not be able to do anything. The roommate for the same thing. And to the guy, because addiction isn't always your fault. It's a disease or an infection almost that needs to be treated. Unfortunately, though, it's a treatment that has to start with wanting the treatment. Story 11. Not a doctor/hospital staff, but my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it and he got kicked in the gut. He was in a lot of pain, could barely move due to the abdominal pain, so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge, like volleyball size huge, and he may have survived if he came in sooner. By the time we got him into the hospital, he had a severe case of gangrene. His leg needed to be amputated within a day of him getting there, and he passed away a week later. Story 12. Not a doctor, just a student shadowing. During the pandemic, a guy with a history of heart issues had a heart attack, with classical chest pain. Then he had symptoms of heart failure, which he recognized because it had happened to him before. But he still waited for a few days because he was worried about coming to the hospital during the pandemic. Finally, it got so bad he couldn't breathe from the fluid backed up into his lungs that he came into the ER, when he was obviously hospitalized. My professor also said he recently had a patient with an aortic aneurysm who was misdiagnosed because she only had a telehealth visit, no imaging due to the pandemic. She ended up with an aortic dissection. Edit. She was first seen at an outside hospital but went to our institution for a second opinion. She did all the right things. Outside hospital made the error to not do imaging. The COVID-19 pandemic is hurting people who get sick, but also all the people not getting the treatment because they need to avoid hospitals. Story 13. I am a doctor, and while working in A&E, we had an older chap, possibly in his 70s, who several days prior to presentation had a sudden onset severe chest pain and vomiting while loading the car while shopping. He ignored it and struggled home. The next day, he started to lose the use of both legs, and by the time he came to the hospital, he had been crawling around his house for several days because he thought it would get better. He had had a major cardiac event, developed a clot which his heart had pumped out, and it went down to his body, broke in half, and blocked off the blood supply to both legs. He literally had dead legs. I don't know what ended up happening to him, but there was no way to save the legs, and I reckon the outcome was very poor, if not fatal. I am in disbelief that people can be like, it'll get better, whereas I'm like, oh, my chest feels a bit funny. I know I'm still young, but maybe I should call an ambulance. Not really, but like, kinda. I just know that I will never be that 70-year-old man who thinks that it'll get better. Story 14. I work in orthopedics. A very common occurrence is a patient is told to follow up within the week. We like to see fractures between 5 to 7 days, and the patient will call on the 6th day and say, "I broke something and need to be seen tomorrow." This is frustrating because we will very rarely have the ability to get a patient in the next day, and if they had called the day of or the day after, we definitely could have gotten them seen. But my number one "why didn't you come in sooner" moment was getting a call from a patient who had broken their forearm 2 months ago and never followed up. I got them scheduled, they no-showed. Rescheduled, they no-showed again. Second reschedule, they arrive with a very obvious deformity to their arm due to the fracture healing incorrectly. If they had just come in, it wouldn't have been an issue at all. Blows my mind that they went almost 3 months without care. Story 15. Obligatory not a doctor. I was sitting in a hostel with an emergency nurse and an emergency doctor that had just found out that while they worked on different continents, they did similar work. We were happily chatting along and this older guy walks in. He overhears that they're in the medical field and comes up to see if he can ask a question. He shows them his leg that's got large black spots on it everywhere below the knee. Both the nurse and the doctor look at it and immediately go, you have to go see the emergency services. That leg is necrotic. You'll lose the leg, if not your life. The guy goes, that's what my doctor back home said too, but the leg feels fine. I'd know if I was dying. You're wrong. Besides, I'm not gonna ruin my vacation by seeking medical treatment. Which left me wondering why he asked in the first place. He goes to sit at the bar, and over the course of the evening, both the nurse and the doctor leave the table to try to get this guy to understand he might not have 10 days. He needs to have this looked at now, without success. Pretty sure if that guy made it to a hospital, the doctors would have asked themselves this question. Story 16. Not a doctor, but was this patient once. My sophomore year of college, I started drinking coffee. And as college students can be wont to do, I drank a lot of it. One evening during midterms week, I get a bad headache. So I drink some coffee and settle in to churn out a few hours of work. My headache goes away, but I start noticing tingling and numbness in the right side of my body. It eventually gets bad enough that I can feel the line down my face where the tingling ends. My whole right side is totally numb. But I think it's midterms week. I probably just need to sleep it off and it'll be fine, right? So I go to bed, wake up for my 8 a.m. and the numbness is worse. Eventually, at like 10 a.m., I finally asked a friend to drive me to the ER. The ER doctor was horrified as I had ignored a very obvious sign of a stroke for at least 12 hours. It ended up being a complex migraine brought on by essentially a caffeine overdose and sleep deprivation. I adjusted parts of my lifestyle, including monitoring my coffee intake, and haven't had a repeat episode. People can just get numbness on their face or head and be like, that's fine, I can just sleep it off. Like, bro, I would be horrified. I'm not gonna wake up tomorrow. And from the sounds of it, OP might not have as well if it was actually a stroke. So yeah, seek medical attention sooner, everybody. Story 17. Nurse here. I work in a very rural hospital, and we have a patient population that seems to avoid the hospital at all costs. I've had so many, usually related to diabetics with foot sores, almost always resulting in amputation of a toe or more. However, my favorite was an elderly farmer who came in with chest pain that wouldn't go away, as he put it. When we asked him if he had had it before, he said that he had been having chest pain on and off for years. But it would typically go away after he grabbed his electric fence. Apparently, the first time he had the pain, he was standing out near an electric fence on his farm, and he reached out to steady himself and accidentally grabbed it, which shocked him and made the pain go away. So after that, whenever he would have the pain, he just went and grabbed the fence and it made him feel better. He was fixed up and sent on his way, but we all still chuckle about it now, because he was just so nonchalant about it. This is... This one's really good. I don't know why. This one's hilarious. Man was just like, it works for me, you know? Story 18. So many stories here. Let's start with a gentleman in his 70s. He was diagnosed with diabetes. His doctor had instructed him that it's important for him to wear socks and supportive shoes throughout the day. So this guy decides that meant, wear the same pair of socks for weeks and never take them off. He had showered, slept, and carried on in the same pair of socks for weeks. He came to the ER because there was blood oozing through his sock and there was pain under there. Take the sock off, he's got a diabetic ulcer that had opened and was full of maggots. Not a pretty sight. We clarified those instructions pretty quickly. Now, in what world are you that confident in medical professionals that you will listen to that, but also not realize that something feels off about it? It's just so weird to me. Man was so confident that he heard these instructions correctly. He was like, yep, just gotta keep these socks on for the whole time. Kind of weird, you know, just kind of weird, but I'll do it. Doctor says, doctor's orders, you know. Story 19. Former medic here. called to a patient who had cut their leg while chopping wood about a week prior, and now it was really itchy. Old gentleman, didn't drive, lived alone. Got to his house, unwrapped the ungodly swollen leg to find out he had tried to super glue the wound closed, and maggots had began to grow inside. The itching he was feeling was the writhing maggots under his skin. Story 20. This has happened a few times, actually. I had a gal come in on Monday after being discharged from the hospital Friday after giving birth. Basically, we tell all ladies to avoid intercourse until a doctor clears you. And, well, her spouse kept insisting and insisting and insisting. That Friday night, she caved and let him go to town. He wound up tearing some stitches that were placed and bleeding like a stuck hog all week long. Came into our clinic, blue in the lips and fingers, and her hemoglobin was 4. Normal should be 12 to 15. She didn't want to be a bother, so she waited until she started feeling dizzy all the time. She got another trip to the hospital for transfusion and repair for that. But like I said, this isn't the first time I've seen that, so for the love of God, if homeboy is begging for it after you just had a baby, maybe he just needs a lesson in self-control and a bottle of moisturizer. I've heard of this too. This is how, kind of pisses me off, to be honest. Hearing about these men who just can't control themselves. Do you hate your wife? What's going on here? Why would you ever want to hurt? Oh my God, okay. Anyway, moving on. Hate men like this. Story 21. Years ago, as a nursing assistant on an oncology floor, we had a guy admitted because he had an erection for several days and had lost the ability to pee. His bladder was close to bursting and his poor junk was, think microwaved hot dog, really bad. But none of that was as interesting as the fact that this guy had untreated skin cancer on his nose for several years that had over time become infected, developed RMSA, and spread across his face. He had no nose, no cheek, and no eye on one side of his face and was starting to lose his other eye. You could see part of his frickin' skull. I don't know why he chose to leave it untreated, and I have no idea how long it took to get that bad, but I will never ever forget the smell and texture of his rotting face. On the upside, we were eventually able to convince him to have reconstructive surgery. He ended up getting a skin graft that covered up his eye, nose, and cheek. So if you ever meet a very grumpy dude with nothing but a mouth and one eye, know that this is way better than the alternative. Story 22. Not a doctor or nurse, but the patient. I went into my doctor with some back pain and also brought up that my leg was swollen. The doctor saw it and said it was probably swelling due to sodium intake. A week later, the pressure and pain in my leg was so bad that it hurt to walk. I called off of work and had my husband take me back into the doctor. The doctor took one look and told me to get to the hospital immediately. He suspected I had a blood clot. I ended up having a massive blood clot from my hip to my knee and pulmonary emboli. I was transferred to another hospital for surgery and stayed in the ICU. Had I waited any longer, I would have died. Can I just say blood clots are one of the things that really scare me. As someone who lives a relatively sedentary and admittedly not super healthy lifestyle, at any point knowing I could just get, a little too much, I don't even know how to describe it. A blood clot, basically. Knowing at any point I could just get a blood clot and it could go bad and everything would go bad. I don't know. If anything inspires me to work out more, it'll be that. Story 23. Not me, but my brother is an EMT for a warehouse. He recently had a guy come to his station saying something was wrong with his toe. So he asks him to take off his shoe, which he does. My brother was about to ask him to take off the bandage around his big toe before he realizes, that wasn't a bandage. It was his skin. Apparently, this guy had dropped a 20-pound tote on his toe a week earlier and had been showing up at work anyway. They sent him to the doctor, and the doctor sent him to the ER. Diagnosis came back as a tissue infection, as well as osteomyelitis, a bone infection. But wait, there's more. The guy came back from the ER and tells him he doesn't want to go through the ER doctor and would rather go through his own insurance. My brother explained to him as best as he could that, as it stood, he was already likely going to lose his toe, and if he waited any longer to get it treated, he ran the risk of losing his entire leg. Not sure what happened after that, but I just hope he got the point. Story 24. I'm a PA in ortho, working in hand surgery at the time. Patient says he had a wrist replacement a number of years ago and has a hole in his wrist. I figure he has a small draining sinus. He comes in. First, I see his x-rays, which looks like he has a massive contracture. Not ideal, but not uncommon. He has a co-band on his wrist, which I peel off to see a 3x6 centimeter hole in his wrist opening directly on his implanted wrist replacement, specifically on the poly insert that allows the two portions of the implants to glide on one another. He said he noticed the hole about, 4 years ago. And when it got so large, he finally decided to see someone. All right, great. Note to myself, if I ever see a frickin' hole on my body that isn't supposed to be there, I should see a doctor. Nuts. Never would have thought of that one. That is all the time we have for stories today, which is probably a good thing because I'm getting frustrated, scared, all sorts of things. I'm feeling a lot of emotions. But thank you so much for watching, and I hope you have a wonderful day or night wherever you are. And if anything is bothering you medically, make sure to see a doctor, because if you don't, I won't be able to see you in the next one. No, but seriously, that's not just for views. See a doctor if you need to, please.